My name is Caitlin Beaulieu. I'm a nurse clinician in the neonatal intensive care unit, and I'm from Montreal.
My name is Lisa Pruitt. I am a field infusion nurse, RN, BSN, and I'm in Augusta, Georgia.
Okay, my name is Ned Pruitt. I'm a professor of neurology, so I take care of patients with all diseases of the nervous system, whether it be epilepsy or Alzheimer's disease or strokes or Parkinson's disease. And I've been here for 25 years on the faculty in Augusta.
Hi, my name is Nikki Shannon. I'm a registered nurse at Augusta Oncology. I live in Augusta, Georgia. I work as a clinical support manager in our practice, in private practice.
My name is Bridget Thomas, and I went to nursing school at the Medical College of Georgia in Augusta, Georgia, and I graduated in 1974, and then I went to I got my master's in nursing in Greenville in North Carolina.
So what motivated you to become a healthcare worker?
I wanted to be able to help people in any way that I could, but I specifically chose to go to the NICU because I wanted to be able to support families and help babies fight the biggest fight of their lives.
My mother was a public health nurse. In the summer, she was the only public health nurse. And so I would go to work with her, and we would go out in the county and see people, and she would have public health clinics, and people would come in to see her. And I just grew up with going to work with her in the summers and loving to do that. And I just sort of grew up wanting to be a nurse, following in my mother's footsteps, I think.
I think I've always wanted to work in healthcare. I had a family member to get cancer, and I became the primary caregiver for our family member. And so that really made me want to be a nurse. I came from a long line of nurses, my grandmother, my sister. So I felt like, I guess I've always been a caregiver. So I went to, I really wanted to become a nurse.
When I was about 12 or 13, I got a volume of Sherlock Holmes stories. And I enjoyed those a lot, primarily because of the thought process and the puzzle, essentially, he had to figure out, as you know, from the stories. And I think that idea of working through clues with a biology bent put me toward medicine. When you're talking to somebody, can you just listen to their complaints? Can you do a close examination? And from those clues of things that are there or not there, can you figure out what's going on with them?
And my first husband was diagnosed with leukemia in 2007, and it was very aggressive. He required a bone marrow transplant. We had to go to Atlanta for, and he did well in that, but then he was in remission for a short period of time, and then it came back. So 2008, he passed away in August. And during that time, so it was a year and a half of very aggressive treatments. We were in the hospital a lot, and I was always with him. The doctors and nurses often said, why aren't you nursing? I said, because I'm a secretary. And I was a secretary at a high school at that time. And after he passed away and grieved for a year, I thought I need to do better by my kids. I need to make more money. I need to figure out a way to minister to others the way we had been ministered to in the hospital. And that resonated in my head continually, why aren't you nursing, from the doctors and the nurses when we were in the hospital. So I went back to the hospital and I said, what do I need to do to be a nurse?
What do you find most rewarding about this job?
I just think helping other people and makes you appreciate life every day. And when you feel like you've got a bad day, all you have to do is think about some of the patients that you've got or some of the diagnoses you see other people facing, and your problems kind of disappear.
I absolutely love being able to help the sickest baby when we don't know what their outcome is going to be, and then seeing them go home after so many months of intensive care. It's so rewarding to see them go home and go meet their brothers and sisters and the rest of their family.
So just the fact that I'm able to see improvement, knowing that there's a therapy that I'm able to be a part of, and I see them every 3 weeks, so I get to see their progress on a continual basis. So it's very encouraging, very encouraging.
And working in oncology, you really have the privilege of working with patients and caring for them probably at the most vulnerable time in their life, and also to care for their family members.
What is the most profound lesson you've learned from being a healthcare worker?
I've learned to always expect the unexpected. You can think that a baby or a patient is going in one direction and that you don't know what medicine or what science is able to do for them anymore. And then they just surprise you and you say, nobody thought that was going to happen.
I think the most profound lesson I learned was when I myself got sick and learned about what it was to be on the other side and be the patient. And so that gave me a really, really good perspective of wanting good communication from the nurses, wanting good communication from the doctors, wanting to know what we were doing, why we were doing it.
It takes a village. It takes everybody to be the eyes and the ears. You know, the physicians really guide us, but it takes all of us. It takes everyone from the front desk to the cleaning people, and we learned that with COVID.
Live life to the fullest every day and appreciate it, and realize that, as I said earlier, that health is your best asset.
How does working in this industry affect your life today?
COVID has taught us many lessons, but really, you need to tell your loved ones and your friends how much you appreciate them and how much you love them every day, because we're not promised tomorrow, and we definitely don't know what tomorrow holds. And working in healthcare, especially oncology, you get to see these patients long term. It's not like in a hospital where they're admitted, you take care of them for 4 or 5 days. With oncology, you take care of them for years. You know about their dog, their children, their vacations, everything. So you bond with those patients, and you need to tell them how much you appreciate them and how much they mean to you, but tell them every day.
I think having a husband that's also in the industry is super helpful, but being a nurse isn't a 9-to-5 job, just like a doctor isn't. He probably told you the same thing. It's not a 9-to-5 job. We're available for our patients, especially because we're their lifeline to their care. And they see me every 2, 3, 4 weeks. They know I'm a direct contact. So it's very rewarding to be able to know that they trust me enough to give me a call just because they have a question, there's a problem.
It's given me a deeper appreciation for my health, but it's also allowed me to see people in their most vulnerable states and be there for them when they need support or when they need help.
What would you say to someone who's interested in joining the healthcare field?
You know, I've always encouraged other people to go into the medical field because it's just the feeling of, it makes you feel good. It makes you be able to feel like you're giving back. You're giving back something. And there's also a lot of job security, and it's a good profession.
I would say do it. There's so many different opportunities for you, whether you want to work with babies, with kids, adults, geriatrics. If you want to work in the community or in a hospital, there's something for you, and there's so many opportunities for you to find where you really belong and where you're going to thrive.
What does World Healthcare Worker Week mean to you?
This week of celebration really lets me know that I can be part of the bigger picture. That, you know, we can be proud of what we do and that we can make a difference. And so, to me, that's what it means the most.
Well, it makes me very thankful that of all the people working in the pandemic right now, that, you know, they're out there giving when their lives are at risk to keep working. I never had to face that. And, you know, I'm very thankful to have been able to follow in the footsteps of my mother. That's given me a lot of internal satisfaction.
Well, I think it's nice that people take a moment and think about people in the healthcare field. But it is nice to be remembered, even if it's a little baggie of Hershey's chocolate kisses on the corner of my desk from the volunteer services. It is nice to know that somebody is appreciating us. We do what we do because we love it, because it's certainly very, very hard at times.
It helps to know that all the sacrifices that we provide for our patients is acknowledged, and we're thankful.
It means taking the time to appreciate the people that are working to help you and all the sacrifices that we make to do so. We work weekends and we work holidays so that you can spend those same weekends and holidays at home healthy with your families.